Okay, welcome everyone. My name is Marie Dietrich Luer, and I'm an assistant professor at the College of Nursing of the University of Saskatchewan. I'm happy to welcome all of you to the fourth and final session of CASN's Climate Change and Nursing webinar series. This webinar series aims to support dialogue on the important topic of climate change and nursing. Before we begin today, I would like to take a moment to respectfully acknowledge that CASN's national office is located on the traditional unceded territory of the Algonquin people. I would invite everyone on this call to take a moment to consider the territory that they are joining this call from and reflect on the privilege you hold in being able to occupy the land that you do. I would also like to go over a couple of housekeeping items. Please note that today's session will be recorded. The recording will be posted on the CASN site and shared through CASN's networks as part of the dissemination strategy for this project. Today's session will begin with presentations from our speakers and will conclude with 20 minutes of question and answer. You may ask questions after the presentations using the chat function on your screen. Alternatively, you're welcome to unmute your microphone to ask your question directly to the speakers. We ask that everyone mute their microphones if they are not speaking during the question and answer, as well as during the presentations, in order to avoid any interference. In today's session of the series, we will first hear from June Kaminski, instructor and course designer and curriculum coordinator at the University of British Columbia and Kwantlen Polytechnique University. In addition to these roles, her research activities and being the lead content developer for the Climate-Driven Vector-borne Disease and Nursing e-resource, June is also an active board member of CASN, the Canadian Association of Nurses for the Environment. We will also hear today from Michael Foley, web designer of the e-resource and founding partner of technology companies Pixarella and Member 365. Holding a deep understanding of database development, web design, and interactive media, Michael has been involved in many aspects of the information technology field over the past 25 years. Today, June and Michael will first share information on CASN's soon-to-be-released Climate-Driven Vector-borne Diseases and Nursing e-resource. To hear more about this work, I'll now turn the session over to June and Michael so we can begin. June?
Thank you. I'm just going to share my screen. Can you see that fine? Okay, so for this webinar, this is our final one related to the Vector-borne Diseases in Canada e-resource. We're going to focus on advocacy, looking at different ways that advocacy can be brought into nursing, and particularly how we've included it in this e-resource. So the outline for this part of the presentation is I'll just give you a very brief project overview and then look at how we designed and structured the e-resource. And then the main part of this will be looking at a particular module that focuses on advocacy, and then Michael will conclude with using the e-resource modules. At first, I'd like to acknowledge all of the people who have supported us, reviewed documents, etc., gave us advice and so on. And these include members of our project advisory committee, a long list of diverse stakeholders, as well as the Canadian Indigenous Nurses Association. So I'll start with the project overview. So the title of this whole project is very long, called the Empowering the Next Generation of Healthcare Professionals with Knowledge, Skills, Tools, and Supports to Address Infectious Diseases Related to Climate Change in Canada. It began in 2018, and we are just finalizing it now in 2021. And it was funded by the Public Health Agency of Canada. The ultimate goal of this project is to enhance capacity of nurses, basically in relation to climate-driven vector-borne infectious diseases by one, increasing the knowledge about this, and then fostering integration of this knowledge into nursing education. So our target population was primarily Canadian schools of nursing, but also any nurse that's working in the workforce. This is a summary of our project advisory committee. This is the first page. You can see we have a very diverse group of experts that were advising us throughout the process. And this just continues on the list. So from education, from government, from patient advocate groups, etc., and also Indigenous experts. Our key deliverables were two things. One was the guidelines that are already up on the CASN website that give distinct targets and objectives and so forth that nursing education can use, as well as the e-resource that we're talking about today. And I'll just show you. This is a screenshot of the first one, the guidelines. And this is a screenshot of the e-resource, so the very first entry page. This is the team that I've had the privilege of working with. So Michael, Andrea, Morgan, Shannon, and I worked with Julia Thomas to create this, and it was a really wonderful experience. We all enjoyed it. And the approach that we used was to make this an open, so it's free to use, access online teaching tool that people can download or access on the web, etc. And it addresses content that you can use and to bring into either education or practicing nurses can view them on their own to bring into their own practice. 4 guiding principles led this design. So we wanted it to be interprofessional and intersectoral. We wanted to use sensitive language and recognize that beliefs of all individuals about climate-related health effects. We wanted to show respectful acknowledgement of Indigenous, and we also wanted to tie in multiple ways of knowing. So trying to make the learning activities interesting, interactive, inclusive, and diverse. To do this, we gathered feedback over many different sessions throughout mostly 2020. And you can see this list, I won't read it out, but you can see that it's a very diverse list and brought multiple perspectives into both the planning, the writing, and then the final review of the e-resource. Now, the e-resource is organized into 5 modules, and these include climate change, a general overview, then an overview of vector-borne infectious diseases, moving on to primary and secondary prevention, and then in number 4, tertiary prevention, and then finally, number 5, awareness and advocacy. And that's the module we're going to look at in a bit, in a couple of minutes. All modules were standardized for structure so that you'll see all of these different aspects within each of the modules. And then each module is further divided down into chunkable lessons. So this is an example of a lesson. This one shows the first module and its 5 lessons, and you can access this particular navigation menu quite easily by just clicking on a little link that's shown in the upper right. And then let's move into module 5, just to give you a taste of how advocacy is interspersed. Now, there are other aspects about advocacy in the first 4 modules, but this particular module is devoted to awareness and advocacy of climate change and vector-borne disease. So we tried to use case study approach through many of the modules. And this particular one was set up so that it was like a nurse educator setting up 7 lessons, because there are 7 lessons in this particular module, to address both awareness and advocacy in a kind of leveled way. So you can see as this particular graphic shows you the titles of the different modules. So it starts with very basic vector-borne diseases and health inequities, moving into equitable care. Then in number 3, looking at culturally safe care, how that can be applied to the care that's being given. And then moving into what are the regulations now, and then advocating for better regulations and integrating policy in number 5. Number 6 also ties in nursing standards and policy awareness. And then finally, finishing with influencing climate change policy in general. This slide just gives you a little bit more detail on each of those 7 lessons. So some of the key topics within them are. So you can, again, you can see that it starts with a kind of basic piece about vulnerability, etc., moving into making it more meaningful to nursing practice, making it culturally safe, and then moving into the policy awareness pieces, which gets from more simple, local, etc., to more global in the end. So again, I'm going to use some screenshots from the actual Module 5 to illustrate how we've approached this. So beginning with Lesson 1, again, we started with VBDs and health inequities. And this particular first lesson is 15 slides long, and it basically covers the general view of vulnerability, who is vulnerable, etc., and how nurses can address this. So you can just see an example here of the beginning piece of this. And then through all of the lessons, critical thinking moments are interspersed to help the viewer reflect on the content. So this is just one example that's included in the Lesson 1. Then Lesson 2 starts looking at how nurses can advocate for equitable care, specifically related to VBD care. So it begins with just a general introduction to it, why it's important, because nurses are one of the most trusted and respected professions, that when they advocate for something, it usually matters and people tend to listen, etc. So it starts introducing what equitable care looks like, and starts encouraging nurses to get involved with advocating for this. It also gives some strategies, like any strategies that nurses choose should be direct and they should be meaningful to the client or the community, etc. Community engagement is key. You know, if you're starting to work with a community and you want to help them to help establish their VBD care and their VBD management, etc., you really need to get in there and get the community engaged. And nursing students should know about this. Also, we give some practical tips on how that can be done. And this is a good example of a screen that has interactive hotspots, so that when you click on any of the little rectangles, you'll get a pop-up that gives you more detail about each of these steps. Same with this. This particular one helps to give equitable care, like what are the different pieces and so forth, so that students can learn the process and so forth and begin to apply it. So again, it's just looking more at like equitable resources are important, and concludes with susceptibility is universal. So we talk a lot about vulnerability and what particular populations might be more vulnerable to climate change related effects, but then conclude with that everyone is susceptible, so that it's really important whenever we're working with any clients that we keep this in mind, that they could be exposed to something like a VBD infection. Then Lesson 3 continues on and adds a layer of culturally safe engagement. Now, this is also a topic that's covered quite extensively in other modules, particularly Module 1 and Module 4, I believe it is, but just how to tie that into advocacy work. So looking at things like how we can apply culturally safe strategies to support climate resilience. And again, this particular lesson has 11 pages in it, so that students and nurses can go through it and learn some strategies to make things culturally safe. So an example here is given how if a client is requesting preventative strategies, or a community is, how students or nurses could intersperse that into their care. And then it just follows up some resources that could be used, giving examples of what students could look for, and then moves into Lesson 4. So Lesson 4 starts to look at policy per se, looking at the existing regulations for VBD care. And so there's about 10 pages in this particular one. Again, looking at current regulation and how nurses can advocate for best practices and regulation. So it introduces the federal framework on Lyme disease. And even though this this resource does focus on vector-borne diseases in general, you'll find that there's main themes of Lyme disease and West Nile virus, since they're the most common ones in Canada, but to be aware of other ones that can exist as well. So this particular piece looks at the federal framework on how we are dealing as a nation with Lyme disease at this point. And again, each of these little graphics, if you click on them, they're interactive. They'll put the a little blurb about it at the bottom. So you'll see I have the medical surveillance one clicked, and that pops up. And again, you could click on education and you'll see another description. Again, just introducing the federal West Nile virus surveillance criteria and how nurses are involved with that. And then gives a little bit of a caveat about the current ISDA guidelines that are typically the most frequently followed in Canada, but also bringing up some points that there are other guidelines available and that to fill in gaps, etc., that nurses, physicians, everyone should be aware of all of the different guidelines that are available and make the best choice. Then moving into lesson 5, looking for more integrated policy, which does relate to what I've just spoke about the different guidelines that are available. This particular lesson offers 11 pages that introduce how nurses can advocate for improved policy that particularly meet the needs of people living with VBD infections. And you'll find that there are a wide assortment of people that are living with chronic VBD infections. So it isn't always taken care of with initial antibiotics, or some people are even missed and not even given antibiotics and so forth. So it's important that nurses are aware of the different things that people are facing and to promote more integrated policies to help them. So one example is to promote people-focused research, particularly involving people who are living with VBD. And a good example of an organization that's doing this is the Canadian Lyme Consortium. So there's a little introduction there, and viewers can click through and visit their website. And then in lesson 6, we start to tie in some nursing standards and directives that focus on this type of engagement and why we should be involved in policy that's related to climate change and inclusive in that with related effects such as increased VBD infection and risk. So it starts with international. So this particular section has 16 pages. Looks at international, national, provincial to territorial, etc., different nursing standards related to this topic. Then we move into the Canadian Nurses Association, example of their position statement. And then start looking at some really vocal and well-established provincial or territorial advocacy ones. An example is the Ontario Group's Advocacy in Action, and the paper that they wrote called Ticking Lyme Bomb that really brings a lot of the people living with Lyme kind of stories into the fore so that nurses are aware of it, and then give suggestions on how nurses can get involved with this and what we should be doing to address this on a national level. And then lesson 7 starts looking at how we can influence climate change policy. So it offers 14 pages that shows some strategies and perspectives that nurses can develop to become effective advocates. And one example is that we can advocate and support established strategies. And one really interesting one that seems to fit nursing well is the integrated vector management strategy proposed by the World Health Association, organization. And it includes 5 different steps. And again, if you click on any of these little pie slices, more information would come up to guide people on how to do this. And again, all of the references and resources used to create this resources is available in our resource section on the site. Also, nurses can support effective campaigns in nonviolent ways, and there's many different organizations that support this, and one in particular is the Canadian Nurses Association and the Canadian Association of Nurses for the Environment, which is an interest group of the CNA. that nurses can join, etc. And again, we're encouraged to initiate and to support public campaigns and be role models on how to do this in effective, and again, as I stress, nonviolent ways. We can also support collectives, and there's many, many collectives sprouting up across the nation, across the world, etc. We can also join other disciplines and so forth to highlight what people need, what do people that are living with VBD types of illnesses need, and so forth, and promote the most effective care. We can also improve ecoliteracy, not only our own, but those of our clients, our students, communities we work with, our peers, and so forth. And again, because we are one of the largest bodies of healthcare professionals that are the most trusted, usually when we speak about things, people tend to listen. So we are really good advocates for involvement. And I'll pass it on to Michael to continue.
Thanks, June. Hi, everybody. With all of the great content that everybody has created, we wanted to make sure that we provided an easy way for you to use the content. So what we've done is we've actually made this resource primarily available to educators, students, and professionals through the website. However, anybody from the general public can come and get access to the content. For each one of the categories, so if we go to educators, for example, sorry, June, I'll just get you to go ahead. The methods of delivery that we're going to provide for the educators are, one, a full module package. And so this will include all 5 modules. Each of the modules contains all the lessons, the test your knowledge, and all of the additional content and resources that go along with it. The second type is going to be through the website, and it's actually a learning management system that we have in the website that allows you to go from lesson to lesson on your own. It's all broken down. So each one of the modules has anywhere from 75 to 120 different slides. So we've broken it down into smaller chunks. So each lesson has approximately anywhere between 10 and 15 slides. So it makes it much easier for people to go through. And then the third format that we're providing is the single module downloads. And the single module downloads allows you to just download module 1 or module 3, depending on which that you want to integrate into your educational program, your professional organization, learning management system. And as you can see here for students, they can simply come to the website and they can go through the program at their own pace. So they'll be presented with all 5 modules over on the left-hand side of the screen. And when they click on them, they can be taken into the smaller compartmentalized lessons within each module. All of these are going to be downloadable from the Vector-borne disease website that we're creating. And they're all SCORM compliant, so you can actually upload them into your learning management system. So for professionals and educators who use a learning management system like Blackboard, Talent LMS, any internal education program within your school, you can actually download them, provide the packages to your LMS administrators, and they will be able to upload them and help you build out this curriculum within the learning management system itself. We started this project back in January 2020. We all got together here in Ottawa and had our kickoff meeting and went through how we wanted to present this. And from our standpoint, we really wanted to make it so that the content was digestible, it was discoverable, and it was somewhat, entertaining might be the wrong word, but somewhat interesting to go through. We didn't want it just to be an information resource. Between January and May of 2020, we developed the draft content. There were a number of review sessions from May through August when the revisions were completed. And as we moved into the fall and winter, we actually started full production on each one of the e-resource modules. We currently have all 5 modules in English completed. 3 of them have been translated. The other 2 are in progress now. And we intend on launching this in the spring of this year. So this is pretty imminent to be happening. Very excited to get this launched. With that, I'll pass it back.
Nope, that sounds good. Thank you very much, June and Michael. And next we will have our guest speaker, Fiona Hanley, who's course coordinator at McGill University, nursing faculty at Dawson College, and Quebec representative for the Canadian Association of Nurses for the Environment, or CANE. Fiona Hanley is a passionate advocate for nursing leadership in environmental and climate health. In addition to her work with CANE, she has had the honor of representing the CNA in a collaborative call to action on climate with federal politicians in 2019 and has been a board member of Synergie Santé Environnement Québec. She is a member of the OIIQ Climate Committee and co-authored the 2019 position paper Les impacts des changements climatiques sur la santé des populations et la pratique infirmière. She was also part of the expert committee for the position paper Infirmières et infirmiers à l'avant-garde d'une planète en santé. To hear more about her work, I'll now turn the session over to Fiona.
Hi, thank you so much for that very nice introduction. I'm just going to share my screen here. And hope that that you can see my, I'm presuming everybody can see my screen.
We can
see it.
Thank you.
Okay, good, thank you. So I'm just going to take a few minutes here, and so I really want to just start by thanking you for asking me to speak today, for inviting me to come to join you in the session on advocacy. And that I think I have to start by saying it's really acknowledging all the amazing work that's gone into the e-resource and how useful it's going to be. It's you know, not only based on the evidence, and it's very inclusive and relevant and sensitive, including cultural sensitivity, but it's also a really beautiful presentation as well too. So I think it covers so many aspects of this. So I'm just going to talk a little bit about, I guess, some of my little journey, in advocacy, and a few little snippets, knowing that, of course, I'm just one of many, many nurses and nurse educators across the country doing some work in this area as well too. And so I'm looking mostly forward to the discussion that we're going to have afterwards. I have to say as well too that just this morning I attended, speaking about advocacy, I attended a really wonderful presentation by it was a webinar organized by the McGill Nurses for Planetary Health, which is an organization primarily led by undergraduate students and graduate nursing students at McGill. And Vanessa Dequila is a nurse here in Montreal working in pediatric intensive care, and was sharing with us her experiences of forming a green team and really overcoming barriers to put really very practical, real initiatives in place. And so I think that's a really wonderful example of some of the young generation of nurses who are very, very committed to taking action on climate and finding ways to do so as well too. I just wanted to put this definition of advocacy from the Canadian Nursing Association. I really like this definition from their website, which captures the concepts of inequity and inequality and the basis of advocacy in social justice issues, which at the core of advocacy is very important to me. At McGill, our program is based on strengths-based nursing, and the Lori Gottlieb in her book of the same name states that an essential role of nursing is to serve as the person's advocate. It requires that nurses protect, stand up for, defend, support, and plead on behalf of the person and the family. She describes it as being the opposite of paternalism and an important characteristic of collaborative partnership, and that it takes qualities such as courage, so standing up for one's beliefs and fighting for what is right, even in the face of opposition, and also self-efficacy, so the belief that one can do something. And I think that really resonates for me in terms of the uphill battle that many of you working in this area have faced over time as well too, but really based in the belief that this really is a very important issue of social justice, and the very integral aspect of understanding of human health that is linked very intimately with our environment. The photograph here is from the call to action that took place last year, 2019, and this was what we mentioned at the beginning as well too. This was a declaration of a climate emergency by organizations like the CNA, the Canadian Medical Association, the Urban Public Health Association, the Canadian Public Health Association, organized by the Canadian Association of Physicians for the Environment. And so meeting with politicians in an election year to really try to give them the message that health is at the heart of climate change, and that they really need to recognize the emergency of climate and the effects on that, and to keep them aware on that Canada really has to keep committed to the Paris Agreement and do everything possible. This photograph also was for me. I guess it was the trigger for getting involved in the CASN project on vector-borne disease, with the first, I think the meeting that we had, I think later that same year, if I'm not mistaken. So in talking about advocacy, I guess I think advocacy is very much like, because you often are facing multiple barriers, and so some of the strategies, you need to have multiple different strategies going in all kinds of different directions. And so that certainly has been my case, is looking for openings, whether it was, in approaching professional organizations to seek collaboration, or, finding like-minded groups, such as Healthcare Without Harm, the Alliance of Nurses for Healthy Environments, writing letters to the editor, writing articles, finding ways to put this into teaching. So all of those different types of opportunities that it involved. And then just quickly how, for me, I guess this is a picture of an article. It's a screenshot of an article from the Globe and Mail, and it was talking about a march that was held in 2004, and at this time it was against the construction of a big thermal gas plant in Sur-Roi, Quebec. And this was being promoted by the Quebec government at the time. And it was estimated that it would produce a level of pollution equivalent to around about 600,000 cars every year. So it was at this demonstration, which I attended, there was a physician, Dr. Harold Dion of the Quebec College of Family Physicians. And he, in his, he was one of the many speakers, as is usual with this kind of a public demonstration. So he described the growing phenomenon that they were seeing of increasing numbers of patients consulting physicians for health problems related to air pollution, that at the time was estimated to be at about 4,000 deaths a year in Quebec and around 1,900 in Montreal. And also that if this project went ahead, it would be going contrary to the Kyoto Accord, which Canada had signed in 1997 and ratified in 2002. So this project would go in direct opposition to this Kyoto target that we needed to have. So I thought I was really struck at this time by the absence of a nursing voice, not to say that there weren't nurses like myself who were present there, but there was no official nursing voice in something like this, which seemed to me very much linked to issues of health. So I reached out to our professional organization, the OIIQ, to see whether they had any kind of position on issues such as this, and what we might do as nurses about this. So the OIIQ, the Order of Nurses of Quebec, in this province, it's the professional licensing body. And it has the mandate to protect the public and to shape nursing for the future. And so the OIQ, though, at that time was not really at a point to be able to take a position on environmental issues. So I decided I would write an article for their journal called Perspective. So this is just a screenshot of that article that was published in 2005, a little ironically called L'urgence d'agir, or the urgency of action. So it was just exploring some of the issues that were related to environmental health, making some recommendations. I have to say I didn't talk about vector-borne disease there. I did talk a little bit about climate change. But as a consequence of that, I was invited to speak at their next conference about this issue, and then subsequently put a proposition forward. So that's my little thing at the bottom here, that I thought that in order to be able to come out with position statements in relation to things like air pollution, for example, then there needed clearly to be a committee. So that was their response to the proposition that I had made at the time. But at that time, it was seen really that nurses it would be more in the domain of public health rather than in regular practice as well too. So the other organization that I reached out to was the Canadian Nursing Association. And this, by contrast, were extremely helpful, receptive. Janet Davis was the Director of Public Policy and Communications at the time. You might recognize some of the people in this photograph. That was the taken at the end of this wonderful workshop in Ottawa, organized by the CNA as part of their Centennial Group project. To work on developing tools of different types, because based on a survey that the CNA did in 2007 about the capacity of nurses to work, to use environmental health in their practice, it was found to be a lack. Nurses didn't feel that they had sufficiently enough education. So the goal of this was to develop various teaching tools. Of course, technology was not as advanced as it is right now with things like this wonderful module we have. But nonetheless, there were different papers, position papers and videos put forth to try to help nurses understand some of the issues in relation to environmental health and climate change and greening the health sector, etc. The group was led by Nikki Sims-Jones at the time. So this project went on for a couple of years altogether, I guess. I've just put a little link to one of the videos that is still available on YouTube that was produced by this. And so this led to, at the end, many of the nurses who were involved in this, maybe some of you yourself were involved in this and felt that they really wanted to continue this work. It was so important. And so this led eventually to what has now become known as the Canadian Association of Nurses for the Environment. This is, so I've just given a little a screenshot here as well of what some of the objectives of this organization as well too. And some of I am the Quebec representative for this organization, and certainly it's become increasingly busy, involved with all kinds of issues, including this Nurses Climate Challenge, for example, which is we've just come out with a Canadianized version of this. That was created by the American Alliance of Nurses, but now we have a Canadian version, and there'll be a project drawdown coming out in the spring. So, the link is here to CNHE for people to find out more. Another aspect I think was very important in advocacy was reaching out across borders. So many of you will recognize Dr. Barbara Sattler, who's been an astonishing pioneer in this area. and one of the founders of the Nurses Working Group, who I had also reached out to at the time and became involved with some of their work there, the Nursing Luminary Group, and all of their astounding work there as well too. They are quite a remarkable organization as well too. So, and I mean, collaboration, as we have said, is very important in advocacy as well too. We continue to learn from each other and move forward in that way. This is just a screenshot of the position paper that we mentioned at the beginning of the Francophone Nurses organization, global organization, and their position paper, which came out in 2019. Other collaborations are Synergie Santé Environnement, we mentioned as well too, which is an NGO based in Quebec. It's the Quebec equivalent, if you like, of Healthcare Without Harm, working with hospitals to try to decrease their environmental footprint. For me, another organization that was a very good opportunity for collaboration was an association of college-based nursing educators here in Quebec. And so with my colleague, Bruno Pilote, we have done some educational sessions with them so that nursing teachers could understand more about climate and health and how to integrate that. So certainly an opportunity for when we do this again this year for being able to integrate the information about the modules in there. A couple more things in terms of formal education. I found without a major curriculum change, that there were, like many of you, you found opportunities in classroom teaching as well. So this was a class that was developed in a pediatrics maternal child course based on they have a competency of health promotion. So for me, it fitted very well with that competency in looking about, well, how what's the role of nurses in promoting health in relation to environmental health, and subsequently much more about climate included in there as well. That class, that's an old slide picture. Obviously, the class is still ongoing, and I think there have been many opportunities in that course, maternal child health, where students have been placed in schools or daycares to develop. They've often done some teaching as part of some of the work that they are required to do. When I think of one of them, for example, was students placed in a primary school. They saw the school buses idling in front of the school. They decided to do a project about informing about the issues in relation to air quality and school buses, and it went up to the level of the school board, to the point that then they decided to have a new policy on school bus idling in front of the school. So I think many, I'm not going to go into many of the details, but many of those kind of opportunities that I have found in teaching, of students doing peer-to-peer teaching as well too. So when they have a teaching and learning event, they can often integrate issues to do with the environment. And I have to say, I've been impressed over and over again by the ideas that students come up with, the topics that they take. It's really quite remarkable to see. This is just, I apologize for this very busy slide. It was just to show you, I talked about multiple strategies. So this was just some of them different collaborations. I'm not going to go through all of this as well too, but with all different kinds of organizations, from KIPCHI, which is astonishing, organizing workshops with them at different places, the university and the college. Working with my colleague Sonia in the University of Mount Royal College in Calgary and so forth. So reaching out sort of here in Belgium, in France, with some of my colleagues there as well too. Even with my kind of fun thing was working with the chemistry faculty on a PED day activity that we did, talking about chemistry and some of the issues in relation to chemicals and exposure. So just last couple of things. This is the position paper that came out of really another opportunity in the end of 2019, when there was so much energy involved and so much thought going into climate change. Everybody was talking about climate change then. So I met with the new president of the OIIQ, Monsieur Luc Mathieu, And after that meeting, it was decided to create a climate committee with the Order of Nurses of Quebec. And with one of the first missions was to produce a position paper. So this was the position paper that was there, recognizing that this is part of nursing practice in Quebec, and that nurses are called upon to adapt this practice to their issue. And I've continued collaborating with them. So we have a paper coming out in the journal in the spring edition on climate change and health. And then this is just in terms of some of my teaching at McGill. We were just talking with my students, my grad students there in advanced practice. And so we were discussing some of the different ideas of things that they can think about in terms of integrating that into their own practice as advanced practice nurses, whether it's in the bedside, in administration, in education, in prescribing things like prescribing parks, for example, prescribing ecotherapy, creating green teams, etc., in the context of this Code Blue for the climate. And I think I'll end there. This is a picture of my friend John at another march here in Montreal, kind of an old sign. You can see a handmade sign that we had at the time, nurses take care of the earth, but trying to also give that message that, yeah, the nurses are there, and that we're advocating in every possible opportunity that we have, whether it's personal or in our own homes or in our work or out there in the street. So I think I'll end there. Thank you very much. I'm going to stop the share.
Thank you very much, Fiona. It's very inspiring to hear about your work, and I just think it's so important for nursing to have a voice and for us to see examples of nurse advocacy in action and what that looks like. So that was great. I now throw it open for questions. If you have any questions for Michael or June or Fiona, you can enter them into the chat, or you can just unmute your microphone if you have comments or questions and just ask them directly. And just a reminder, you can enter it into the chat. I have one comment just about facilitators and barriers. I'm wondering if people are thinking what's the best way to use this resort and how it might look in your own curriculum. And so for me, I'm thinking, well, a facilitator they're just fabulous modules, and that, if anything, it may be trying to figure out, and that may be a barrier, where they fit into the curriculum and which courses they best belong in, and making sure we don't kind of duplicate those. I don't know if anyone has any thoughts about what they think is a good facilitator to help bring these into your program. And then I have a question from Sue, but does anyone have any thoughts on the best way to integrate it into your curriculum?
I don't know if I have an answer about the best way to do it. I think it's going to be something that I think that you can always find some space, no matter how crowded your curriculum seems to be, and sometimes in linking it with some other aspect, like I mentioned, different, if you have a competency-based program, then how you link it with that competency. And I think that one of the things is that now we're so much more used to e-learning. A year or two ago, we weren't really that familiar with that. But now I think that it's certainly timely in the sense that now all of us are pretty used to being able to do that as well too. So I think it's going to depend on different programs, but certainly it lends itself to all kinds of different ways, I think. And there's such an ease of access, and it's such a user-friendly kind of material as well too. I think I don't see that there are going to be a huge amount of barriers in using it. It's more the time that's going to be devoted to how it's decided to be used.
Okay, and we have a question from Sue for maybe Michael and June, is regarding the e-resource, the Living with Vector-borne Disease, and wondering if this module is going to be a living document, if advocacy groups can update relevant information and resources for that particular part of this initiative.
I'll just interject. I think, Michael, you might want to address the section we have that's separate from the modules. It's not a specific module, Living with Vector-borne Disease, but it's definitely a resource on the site.
Yeah, throughout the 5 modules, there are some case studies that are dealing with people living with vector-borne disease, as well as there's some resources on the website that are going to be there. In regards to updating relevant information, this is probably more a question for CASN, but I do believe that the resources themselves are reviewed and updated as required.
Yeah, I'm happy to build on that. Thank you, Michael. For sure, I think the question was, will it be a living document? And what we're wanting to do is include a feedback mechanism on the website, Sue. So for anybody that's looking at content, and if they, there are new publications, the new information that's coming out over the next few years, they can, and it's not represented or needs updating on our site, anyone can send us an email and share that with us, and we'll be able to either correct or update. Typically at CASN, for all of our knowledge products that we develop, we undergo an updating every 5 years. So we start the process on year 4, where we pull together a committee or a task force to go through a more formal review and updating process as well.
And could you maybe remind folks where they can find that extra result? So there's a learning module, but then there's a question just about the living with vector-borne disease and what that looks like and where it is.
Mm-hmm. Yeah, and so the modules will be accessible through an e-resource website. So when we are launched, everybody that's attending this these webinars or have connected with us through over the course of the project will receive a notification about the fact that we've gone live, and they'll receive the URL. And so that URL will give them direct access to the modules, and then linked to the homepage of the website is the Living with Vector-borne Disease web page, where we will have included information that was shared with us from our patient advocate stakeholders.
Thank you. Do we have some more questions or comments? Michael, I have one from a couple of sessions ago I was curious about, because my program's across several sites, and although we like to know what every other instructor's doing across all courses and all sites, we don't always. So did you say that there was, when it gets uploaded, that there was some mechanism so that like a university or college would know who's using the modules and which modules?
So if you use a learning management system within your school, your university, college, typically if you use the module, you'll be able to collect information on who's actually using, who's actually going through the course within your own learning management system. With what we offer on the website, we're going to be collecting information from people, but it's not very specific. So we're not asking people for their name, their address or anything like that. We're asking them why they're there and where they're coming from. and what they're using the resource for, but we don't collect, specific information on anyone. Educators and professionals can opt in to receive email updates if there is a modification to the module, so that they can download and update the course in their own learning management system. So that's the intent on keeping everybody up to date with that. But we're not collecting specific data about who is actually taking the course online.
I actually have a question as well too, because I think it was also asked in a previous session, and I don't remember whether we have an answer. Is in terms of CE credits for the for doing the modules. So here, like in other places, all nurses need to do a certain number of accredited hours to maintain their license. So I'm not sure whether that is associated with the modules or not, or yet, or whether that's going to be the case as well. Because
I think
certainly
that's more for
getting a bit more
CASN.
buy-in,
I don't know if this is an accredited module.
No, it's not an accredited module. We don't have that, but we do, we have talked about including some sort of a certificate at the end of the modules, so that that can encourage learners to complete the sections.
Okay, thank you. Thank you. Yeah, because I think that's a question that has come up from people have asked me about that as well too.
Do we have some other questions? I was wondering how long, like each module is somewhat different length, how long in total, when you're trying in terms of a barrier to fitting it into the curriculum, all 5 of the modules together, is there an estimate of how long it might take a student to do that? I can sort of see it being, because everybody's trying to fit new content, and this is important new emerging content in, maybe different modules might fit into different courses sometimes, but how long, do you have an estimate in total?
So we have been undergoing testing over the fall. As we were developing the modules, we did kind of send them out for some testing to see how user-friendly they were, as well as the time for completion was one of the questions that we had. And on average, I think it was about 2 to 4 hours, but I think there's a range depending on how users or learners go through the modules, because it is information rich. And so it was a concern. Time was definitely a concern that came up in previous webinars when attendees were thinking about how to integrate content into already very, very tight curricula. So it's definitely something that we've thought about, and even most recently, Michael came up with some innovative strategies to facilitate it a little bit so that we could chunk the content further. Our original sort of presentation of the content was that you would have to move through each module 1 slide at a time, whereas now you can actually cherry pick slides. You can go in, it's broken up into modules, but you can also, the modules are further broken down into lessons. And so that way, educators and other learners can sort of pull pieces in where it's relevant for their courses versus having to integrate the entire package or use it as a whole. It also allows learners to move in a non-linear fashion through the module. So you don't necessarily have to complete it from start to finish, but you can sort of select sections of interest.
Thank you. Okay, should I wind down then? Is there any last minute questions? We're running out of time. I don't want to cut anyone off. Well, thank you again, June and Michael and Fiona. Great session, and thank you to everyone who participated. I just want to remind everyone that a recording of the session will be made available on CASN's YouTube channel, and it'll be circulated to you in the coming days. Please feel free to share that link widely within your networks. Thank you again, everyone, and CASN certainly hopes that you visit their website, casn.ca, for updates on the project and for the climate-driven vector-borne diseases and nursing e-resource. CASN will be sending you a feedback survey in the coming days to hear your feedback on the e-resource, and so please look out for this email and respond with your feedback. So thanks, everyone. Thank you again for your participation today.